Live in Times Square, this is GMA.
Coming up, how to treat the pregnancy mask, a condition affecting millions of women. Ginger faced it. Now she's revealing how she helped her skin heal. Back now with that health alert about a skin condition that affects millions of women who have just had a baby or are on birth control. They call it pregnancy mask. And Ginger, it is wonderful that you are sharing the experience that you've had with it.
Yes, because there's hope, and I think that's the whole part. I felt like Alicia Keys was going makeupless. I was like, I want to do that. And you have to know that 5 million Americans are dealing with this, and it's basically just blotchy skin. After I had Adrian, I totally changed, but you can change back to your old skin too. Take a look. I want to show you something.
This is how you see me every morning for Good Morning America, fully spackled with makeup. But underneath, I'm hiding discolored skin. It's called melasma.
Melasma is a condition that can affect up to 70% of pregnant women. It's triggered by hormones causing blotchy, dark patches, particularly on the forehead, cheeks, and upper lip. After I had my little guy, I noticed my face became far from even. So I went to dermatologist Whitney Bowe.
It's dark here and dark here.
To get my pre-baby complexion back.
I thought I'd come in here and have to get laser, but that is not true.
Actually, the heat and the light from lasers can make melasma worse. It's almost impossible to cure it. We can make this dramatically better, but it's going to take time. We're going to have you put your chin right here.
Dr. Bowe scanned my face with this Visia system to look deep below the surface of my melasma.
So that patch is going to be pretty stubborn to treat.
And started my treatment with a gentle chemical peel.
It's not terribly uncomfortable, and there's no downtime. There shouldn't be any real peeling.
Right.
So a lot of people
like a
think,
peel is an appeal.
Yes.
My daily routine included my new best friend, sunscreen.
Even though it's cloudy, gotta use 60 plus.
Mixing it with an antioxidant serum in the morning and covering up every time I went out in the sun.
So I mixed for you what I call a melasma emulsion. Apply it only on the dark marks at night before you go to bed.
After 3 months,
And there it goes, right on the spots.
and a few more office visits, I was on my way to healthier looking skin.
All I wanted was to be able to walk out and be makeup free, and now I feel like I can do that. Yeah, so I'm almost done taking the makeup off, and now I truly feel comfortable, and it's a really nice feeling, because I think a lot of folks feel this way. It doesn't mean you had a baby. A lot of women, just tons of women.
Birth control, yeah, that. And you said 6 months ago you would not have been
No, it would have been
this.
big chunks, and it made it almost this part, you know, whiter and this part darker, and it just felt uncomfortable. You already feel uncomfortable after a baby a lot of times. So.
All right. Well, Ginger, let's bring in your doctor, board-certified dermatologist, Dr. Whitney Bowe, ladies and gentlemen. How are you? My goodness. You know, when people hear chemical peel, and you said the same thing, you go, oh, so tell us about that.
Right, exactly. You know, the chemical peels that I use for melasma, they literally take a few minutes, and there's little to no downtime.
Okay.
So basically what I do is I take a very, very mild acidic solution, and, you know, the ingredients in here, they'll vary over the course of the treatment, and then I literally just coat or paint. Do you mind?
Yeah, no, go for it.
Okay, I just coat or paint a very light coat.
Is there any
onto the
burning
skin.
sensation or anything?
It's so minimal. I was so surprised. I thought it was going to be like a horror show, like skin falling off in chunks. It really feels like lotion going on, and then yes, it burns for about 5 minutes, but very, very minimal. And then you feel fine. I put on makeup again. I did Rachel Ray right after I had
Right,
one
that was the day she came to my office, and literally a couple hours later, you're on camera again.
It's also just not as scary. I think I thought I was going to get lasers all over, and it's very simple.
And there are a lot of myths out there, so why don't you bust some of them for us?
There are. You know, if you Google home remedies for melasma, you will find pages that list lemon juice as a key ingredient, and that is a myth.
Okay.
Don't do it.
Citrus fruits, they can irritate the skin, make melasma so much worse. Another myth, you know, people think that the more powerful the laser, the deeper the chemical peel, the faster the results, but actually the opposite is true. You know, that heat, that irritation, it can really set you back.
And this took months, and that's the other thing, is you have to have patience
Give it
before you
time.
can get
That's
clearer
key.
skin.
Ginger will be the first one to tell you that she is very fortunate that she had you to help her get her through that.
Yes.
There's some people who don't have that. So what can they do at home to get similar results?
You can fight melasma using over-the-counter products on almost any budget. You just have to know what to look for.
And what should you?
So you want to look for creams, lotions, or serums that contain brightening ingredients like vitamin C, kojic acid, licorice, soy. Sun protection is key, of course, but again, I can't stress enough exactly what Ginger said. You have to be patient. When it comes to melasma, slow and steady wins the race.
And that's what everybody, you know, I posted this last week and I had so many people respond, please help me. I can't have the expensive chemical peels, but using these over time will help. And the most important, and this is what she's gotten me into, you hear it so much, but it's wearing a hat in the sun.
That sun protection.
The sun protection, and then wearing that 60 SPF. So I have become that is such an important part of my daily routine. And then even the powders, you give me a powder that has SPF. There are so many ways that you can do that, and everybody at home can do for a very, very, minimal amount of money.
And it doesn't matter your skin complexion because there are African-American women, all types of types.
Actually, the darker the skin type and the more pigment in your skin, the higher your risk for melasma.
Yeah,
so absolutely. So sun protection for everyone.
All right.
Look at the face.
Thank you. Makeupless. I'm staying like this the rest of the show, by the way.
I'm so envious that you don't have on makeup. Coming up, Christy Brinkley's daughter's opening up about that photo shoot with her mom and what it was like growing up with her. Come on back.